Hi, I'm Marlene Tromp, president of Boise State University. Universities have a threefold mission: research, teaching, and service. A lot of our research is focused around healthcare and health issues. And our service is not just to our students or our faculty or our staff, but also to our whole community. This video is designed to give you practical tips to navigate the global pandemic we're facing right now. Please watch it carefully.
Hello, I'm Dr. Ken Cornell. I'm a professor in the Department of Chemistry and Biochemistry here at Boise State University. I have a specialization in infectious diseases, and so today what I'd like to talk to you about is the latest coronavirus outbreak that's being caused by COVID-19. Coronavirus is part of a family of viruses. We have a number of these already circulating in the population. They cause mild respiratory disease. This particular outbreak originated in mid-December in the Wuhan district of China. Since that time, it spread rapidly and has now gone globally or caused what we will call a pandemic. If we step back for a second and think about the disease that COVID-19 causes, this is typically an upper respiratory tract disease. Mild symptoms include things like a runny nose, a cough, a mild fever. We would typically classify these as flu-like symptoms because they represent the kinds of symptoms that we see from a whole bunch of different respiratory illnesses.
You might be hearing a new phrase that suddenly seems everywhere, from a nightly news segment to a hashtag in your Instagram feed. I'm talking about the phrase, flatten the curve. Across campus, I've heard students and colleagues ask, what exactly is this curve we're talking about? What we're talking about is something that health science studies students in my epidemiology class have been hearing about since the first week of the semester. We're talking about something called the epidemic curve. This curve is really a graph. It has time on the x-axis and number of new cases on the y-axis. In an outbreak like we have with COVID-19, epidemiologists make a bar chart that shows the number of new cases that occur every day. When I say case, what I mean is a person that tests positive for the COVID-19 infection. With a brand new virus like this, the number of new cases per day starts out small and increases as people spread the disease to one another. The more contagious the disease and the less we do to avoid passing it to one another, the more cases we get from one day to the next, and the steeper the curve. Over time, as people begin to recover and develop immunity, the curve levels out and begins to drop. Here in red is an example of the epidemic curve without protective measures like transitioning to remote learning, like we're doing here at Boise State, postponement of events, social distancing, and hand washing. The problem with a steep curve is that when you get to a certain number of cases, you start to saturate the medical system. There are only a certain number of hospital beds and ventilators, for example. So if your curve is steep and therefore tall enough to surpass your available resources, then some people can't get the treatment they need. When an infection like this is spreading through a community, we want to do everything we can to keep everyone from getting sick at the same time. This means reducing the rate of new infections like you see here in this blue curve. We want to slow down the speed at which the infection passes through our community so that by the time new people are infected, some of the previous patients have recovered, and there's enough room in our healthcare system to take care of everyone. If we can do this, then people can get the care they need. This is what we mean by flattening the curve. And the best part is that you can help. At a time when so many things feel out of control, this is the piece that you can contribute to.
Hello, my name is Juliet Tinker from the Department of Biological Sciences, and I'm going to talk today about three things in regards to the new SARS-CoV-2 or coronavirus. I'm going to talk to you about testing and treatment and new vaccines that are in development. So as far as testing is concerned, you will not be tested unless it's recommended by your doctor. And currently we have three prioritized groups for testing, and that includes those that are hospitalized with severe symptoms, such as those that Dr. Cornell has just talked about. And the other group would be those that are in contact with anyone who has tested positive for the coronavirus. And the last group would be those that are at high risk because they have underlying medical conditions as well. So that's the testing itself is a nasal swab or a throat swab, and that gets sent to a lab. The Idaho State Bureau of Labs is doing most of our testing in Idaho currently. And that test is based upon identification of the RNA of the virus. And so it will determine whether you have an active infection. As far as treatment goes for the virus, at the moment we don't have any FDA-approved treatments, but there are a number of them that are in development, and we will likely have some treatments soon. Most cases, I want to stress, are mild and they do not require treatment or hospitalization. But if you are hospitalized currently, the treatments are supportive. As far as vaccines are concerned, we do not currently have a licensed coronavirus vaccine. That being said, you should really go and get your flu vaccine because we do have a good flu vaccine this year, and currently flu is circulating, so you don't want to get influenza. If you get influenza right now, that could stress the healthcare system, and also it could dampen your immune response, so it might make you more susceptible to getting coronavirus. As far as the vaccines that are in development, we have one right now that is actually undergoing human clinical trials in Seattle, and so that one is moving pretty rapidly, but still most likely we will not have any vaccines for at least a year.